ProPublica is staying on the necks of these forced birther states. I do wonder how many women need to die in these supposed pro-life states in order for them to make any changes. I doubt anything will come of this because this happens to be a Black woman, but still, let's get into this story. They title it "A Third Woman Died Under Texas Abortion Ban." Texas are avoiding D&Cs and reaching for riskier miscarriage treatments. 35-year-old Porsha Ngumazi's case raises questions about how abortion bans are pressuring doctors to avoid standard care, even in straightforward miscarriages. Wrapping his wife in a blanket as she mourned the loss of her pregnancy at 11 weeks, Hope Ngumazi wondered why no obstetrician was coming to see her. So this woman was married. She was married, y'all. She wasn't one of those women over there that's living all loose and lascivious. Over the course of 6 hours on June 11, 2023, Porsha Ngumazi had bled so much in the emergency department at Houston Methodist Sugarland that she needed 2 transfusions. She was anxious to get home to her 2 young sons, but according to a nurse's notes, she was still passing large clots the size of grapefruit. Hope dialed his mother, a former physician who was unequivocal. "You need a D&C," she told them, referring to dilation and curettage, a common procedure for first trimester miscarriages and abortion. If a doctor could remove the remaining tissue from her uterus, the bleeding would end. But when Dr. Andrew Ryan Davis, the obstetrician on duty, finally arrived, he said it was the hospital's routine to give a drug called misoprostol to help the body pass the tissue, Hope recalled. Hope trusted the doctors. Porsha took the pills according to records, and the bleeding continued. 3 hours later, her heart stopped. The 35-year-old's death was preventable, according to more than a dozen doctors who reviewed a detailed summary of her case for ProPublica. Some say it raises serious questions about how abortion bans are pressuring doctors to diverge from the standard of care and reach for less effective options that could expose their patients to more risk. Doctors and patients described similar decisions they've witnessed across the state. It was clear Porsha needed an emergency D&C, the medical expert said. She was hemorrhaging, and the doctor knew she had a blood clotting disorder, which put her at a greater danger of excessive and prolonged bleeding. Misoprostol at 11 weeks is not going to work fast enough, said Dr. Amber Truhard, an OBGYN at the University of New Mexico Center for Reproductive Health. The patient will continue to bleed and have a higher risk of going into hemorrhagic shock. The medical examiner found the cause of death to be hemorrhage. D&C, a staple of maternal health care, can be life-saving. Doctors insert a straw-like tube into the uterus and gently suction out any remaining pregnancy tissue. Once the uterus is emptied, it can close, usually stopping the bleeding. But because D&Cs are also used to end pregnancies, the procedure has become tangled up in state legislation that restricts abortions. In Texas, any doctor who violates the strict law risks up to 99 years in prison. Porsha's is the 5th case ProPublica has reported in which women died after they did not receive a D&C or its second trimester equivalent, a dilation and evacuation. 3 of those deaths were in Texas. Texas doctors told ProPublica the law has changed the way their colleagues see the procedure. Some no longer consider it a first-line treatment, fearing legal repercussions or dissuaded by the extra legwork required to document the miscarriage and get the hospital approval to carry out a D&C. This has occurred, ProPublica found, even in cases like Porsha's, where there isn't a fetal heartbeat or the circumstances should follow under an exception in the law. Some doctors are transferring those patients to other hospitals, which delays their care, or they're defaulting to treatments that aren't the medical standard. Misoprostol, the medicine given to Porsha, is an effective method to complete low-risk miscarriages, but is not recommended when a patient is unstable. The drug is also part of a 2-pill regimen for abortions, yet administering it may draw less scrutiny than a D&C because it requires a smaller medical team and because the drug is commonly used to induce labor and treat postpartum hemorrhage. Since 2022, some Texas women who were bleeding heavily while miscarrying have gone public about only receiving medication when they asked for DNCs. One later passed out in a pool of her own blood. Stigma and fear are there for DNCs in a way that they are not for misoprostol, said Dr. Allison Golden, an OBGYN in Houston. Doctors assume that a DNC is not standard in Texas anymore, even in cases where it should be recommended. People are afraid. They see DNC as abortion, and abortion is illegal. And here is a man visiting his wife who was just 35. They have two young sons, and she should still be here and be alive. Doctors and nurses involved in Porsha's care did not respond to multiple requests for comment because, of course, they didn't. Several physicians who reviewed the summary of her case pointed out that Davis's postmortem notes did not reflect nurses' documented concerns about Porsha's heavy bleeding. After Porsha died, Davis wrote instead that the nurses and other providers described the bleeding as minimal, though no nurses wrote this in their records. ProPublica tried to ask Davis about this discrepancy. He did not respond to emails, texts, or calls because, of course, he didn't. Houston Methodist officials declined to answer a detailed list of questions about Porsha's treatment. They did not comment when asked whether Davis's approach was the hospital's routine. A spokesperson said that each patient's care is unique to that individual. All Houston Methodist hospitals follow all state laws, the spokesperson added, including the abortion law in place in Texas, where they can actually allow women to die. They can actually allow women to die. Ken Paxton went to the Supreme Court, and the Supreme Court said that Texas doctors can let Texas women die. Here is Hope with his two sons. Hope marveled at the energy Porsha had for their two sons, ages 5 and 3. Whenever she wasn't working, she was chasing them through the house or dancing with them in the living room. As a finance manager at a charter school system, she was in charge of the household budget. As an engineer for an airline, Hope took them on flights around the world to Chile, Bali, Guam, Singapore, Argentina. The two had met at Lamar University in Beaumont, Texas. When Porsha and I began dating, Hope said, I already knew I was going to love her. She was magnetic and driven, going to earn an MBA, but she was also gentle with him, always protecting his feelings. Both were raised in big families and they wanted to build one of their own. And I want to stop here and say that these abortion bans are harming women who actually want to have children. They're not actually harming these child-free women who will just go out and get sterilized. They're harming women that are trying to expand their families. When he learned Porsha was pregnant, again in the spring of 2023, Hope wished for a girl. Porsha found a new OBGYN who said she could see her after 11 weeks. 10 weeks in, though, Porsha noticed she was spotting. Over the phone, the obstetrician told her to go to the emergency room if it got worse. To celebrate the end of the school year, Porsha and Hope took their boys to a water park in Austin. As they headed back on June 11th, Porsha told Hope that that the bleeding was heavier. They decided Hope would stay with the boys at home until a relative could take over. Porsha would drive to the emergency room at Houston Methodist Sugarland, one of the 7 community hospitals that are a part of the Houston Methodist system. At 6:30, 3 hours after Porsha arrived, she saw huge clots in the toilet, significant bleeding, the emergency physician wrote. I'm starting to feel a lot of pain, Porsha texted Hope. Around 7:30, she wrote, she said I might need surgery if it doesn't stop bleeding, referring to a nurse. At 7:50 p.m., after a nurse changed her second diaper in an hour, come now. Still, the doctor didn't mention a DNC at this point, records show. Medical experts told ProPublica that this wait and see approach has become more common under abortion bans. Unless there is overt information indicating that the patient is at significant risk, hospitals administrators have told physicians to simply monitor them, said Dr. Robert Carpenter, a maternal fetal medicine specialist who works in several hospital systems in Houston. Methodist declined to share its miscarriage protocols with ProPublica or explain how it is guiding doctors under the abortion ban. This is a long article. There will be a part 2. This is part 2 of the ProPublica article highlighting this death of Porsha Ngumazi. She should still be alive, but doctors didn't provide the accurate care. But it doesn't matter in Texas because in Texas, the doctors can let women die. But let's jump back into this. She's now in the hospital. She's miscarrying. She's telling her husband, Hope, to get there now. So, like I said, she told her husband, Hope, to come now. Now it says, as Porsha waited for Hope, a radiologist completed an ultrasound and noted that she had a pregnancy of unknown location. The scan detected a sac-like structure, but no fetus or cardiac activity. This report, combined with her symptoms, indicated she was miscarrying. But the ultrasound record alone was less definitive from a legal perspective. Several doctors explained to ProPublica. Since Porsha had not had a prenatal visit, there was no documentation to prove she was 11 weeks along. On paper, this pregnancy of unknown location diagnosis could also suggest she was only a few weeks into a normal developing pregnancy when cardiac activity wouldn't be detected. Texas outlaws abortion from the moment of fertilization. A record showing there is no cardiac activity isn't enough to give physicians cover to intervene, experts said. Dr. Gabriel Taper, who recently worked as an OBGYN resident in Austin, said that she regularly witnessed delays after ultrasound reports like these. If it's a pregnancy of unknown location, if we do something to manage it, is that considered an abortion or not, she said, adding that this was one of the key problems she encountered. After the abortion ban went into effect, she said, there was much more hesitation about when can we intervene? Do we have enough evidence to say this is a miscarriage? How long are we going to wait? What will we use to feel definitive? At Methodist, the emergency room doctor reached Davis, the on-call OBGYN, to discuss the ultrasound, according to records. They agreed on a plan of observation in the hospital to monitor the bleeding. Around 8:30 p.m., just after Hope arrived, Porsha passed out. Terrified, he took her head in his hands and tried to bring her back to consciousness. Babe, look at me, he told her. Focus. Her blood pressure was dipping dangerously low. She had held off on accepting a blood transfusion until he got there. Now, as she came to, she agreed to receive one and then another. By this point, it was clear that she needed a DNC. More than a dozen OBGYNs who reviewed her case told ProPublica. She was hemorrhaging, and the standard of care is to vacuum out the residual tissue so the uterus can clamp down, physicians told ProPublica. Complete the miscarriage and the bleeding will stop, said Dr. Lauren Thaxton, an OBGYN who recently left Texas. At every point, it's kind of shocking, said Dr. Daniel Grossman, a professor of obstetrics and gynecology at the University of California, San Francisco, who reviewed Porsha's case. She is having significant blood loss, and the physician didn't move towards aspiration. All Porsha talked about was her devastation of losing the pregnancy. She was cold, crying, and in extreme pain. She wanted to be at home with her boys. Unsure of what to say, Hope leaned his chest over the cot, passing his body heat to her. At 9:45 p.m., Esmeralda Acosta, a nurse, wrote that Porsha was continuing to pass large clots the size of grapefruit. 15 minutes later, when the nurse learned Davis planned to send Porsha to a floor with fewer nurses, she voiced concern that he wanted to take her out of the emergency room, given her condition, according to medical records. At 10:20 p.m., 7 hours after Porsha arrived, Davis came to see her. Hope remembered what his mother had told him on the phone earlier that night. She needs a DNC. The doctor seemed confident about a different approach, misoprostol. If that didn't work, Hope remembers him saying they would move on to the procedure. Porsha was okay with the idea of pills because the idea of surgery scared her. Davis did not explain that a DNC involved no incisions, just suction, according to Hope, or tell them that it would stop the bleeding faster. The Ngumazis followed his recommendation without question. I'm thinking he's the OB. He's probably seen this 1,000 times. He probably knows what's right, Hope said. But more than a dozen doctors who reviewed Porsha's case were concerned by this recommendation. Many said it was dangerous to give misoprostol to a woman who's bleeding heavily, especially one with a blood clotting disorder. That's not what you do, said Dr. Elliot Main, the former medical director for the California Maternal Quality Care Collaborative and an expert in hemorrhage. After reviewing the case, she needed to go to the operating room. Main and others said doctors are obliged to counsel patients on the risks and benefits of all their options, including a D&C. Performing a D&C, though, attracts more attention from colleagues, creating a higher barrier in a state where abortion is illegal, explained Golding, the OBGYN in Houston. Staff are familiar with misoprostol because it's used for labor and it only requires a doctor and a nurse to administer it. To do a procedure, on the other hand, a doctor would need to find an operating room, an anesthesiologist, and a nursing team. You have to convince everyone that this is legal and won't put them at risk, said Golding. Many people may be afraid and misinformed and refuse to participate, even if it's for a miscarriage. Davis moved Porsha to a less intensive unit, according to records. Hope wondered why they were leaving the emergency room if the nurse seemed so worried. But instead of pushing back, he rubbed Porsha's arms, trying to comfort her. The hospital was reputable. Since we were at Methodist, I felt I could trust the doctors. On their way to the other ward, Porsha complained of chest pain. She kept remarking on it when they got to the new room. From this point forward, there are no nurse's notes recording how much she continued to bleed. My wife says she doesn't feel right, and the last time she said that, she passed out, Hope told a nurse. Furious, he tried to hold it together so as to not alarm Porsha. We need to see the doctor, he insisted. Her vital signs looked fine, but many physicians told ProPublica that when healthy pregnant patients are hemorrhaging, their bodies can compensate for a long time until they crash. Any sign of distress, such as chest pain, could be a red flag. The symptom warranted investigation with tests like an electrocardiogram or X-ray, experts said. To them, Porsha's case underscored how important it is that doctors be able to intervene before there are signs of life-threatening emergency. But Davis didn't order any tests, according to records. Around 1:30 a.m., Hope was sitting by Porsha's bed, his hands on her chest, telling her, "We're going to figure this out." They were talking about what she might like for breakfast when she began gasping for air. "Help, I need help," he shouted to the nurses through the intercom. "She can't breathe." All she needed. Hours later, Hope returned home in a daze. "Is Mommy still at the hospital?" one of his sons asked. Hope nodded. He couldn't find the right words to tell his boys that they'd lost their mother. He dressed them and drove them to school, like the previous day had been a bad dream. He reached for his phone to call Porsha, as he did every morning that he dropped the kids off. But then he remembered that he couldn't. Friends kept reaching out. Most of his family's network worked in medicine. And after they said how sorry they were, one after another repeated the same message. All she needed was a D&C, said one. They shouldn't have given her that medication, said another. It's a simple procedure. It's a simple procedure, the caller continued. We do this all the time in Nigeria. Since Porsha died, several families in Texas have spoken publicly about similar circumstances. This May, when Ryan Hamilton's wife was bleeding while miscarrying at 13 weeks, the first doctor they saw at SurePoint Emergency Center, Stephenville, noted no fetal cardiac activity and ordered misoprostol, according to medical records. When they returned because the bleeding was worse, an emergency doctor on call, Kyle Dimmler, said he couldn't do anything considering the current stance in Texas, according to Hamilton, who recorded his recollection of the conversation shortly after speaking with Dimmler. Neither SurePoint Emergency Center, Stephenville, nor Dimmler responded to several requests for comment. For months, Hope's youngest son didn't understand that his mom was gone. Porsha's long hair had been braided, and anytime the toddler saw a woman with braids from afar, he would take off after her, shouting, "That's Mommy." A couple of weeks ago, Hope flew to Amsterdam to quiet his mind. It was his first trip without Porsha. But as he walked the city, he didn't know how to experience it without her. He kept thinking how she would love the Christmas lights and would try all the pastries, how she would have teased him when he fell asleep on a boat tour of the canals. I thought getting away would help, but all I've done is imagine her beside me. Now, I did skip some of this article because there was a lot to this particular article. They're asking for doctors to weigh in and experts and all of that. I wanted to get to this ending part where we humanize that these are actual women with families that love them and what it's like now to have their mother gone, their wives gone, simply because doctors can allow these women to die. We need to humanize these stories. It's not enough to say 5 women have died a preventative death. No, these are wives and mothers that are being taken away from their families simply because doctors won't do anything. And we need to feel what these people are feeling. Join the conversation. Let me know what you think about this one. Don't forget to like, comment, and